Looking back to April 2007, the task of moving the Valley's only burn and level 1 trauma centers and acute care services from the well-loved but aging University Medical Center site became awe-inspiring as they arrived home to the new Table Mountain Rancheria Trauma Center and Leon S. Peters Burn Center at Community Regional Medical Center in downtown Fresno. After working through the challenges of the move, the Valley's first true academic regional medical center has emerged as the area's premier hospital for the highest level of care. And with only a year under its belt, the future looks bright.
We've come a long way since that big move in April 2007 when then University Medical Center relocated to the new Community Regional Medical Center campus downtown, says Bruce Kinder, Vice President, Academic Affairs.
It's a wonderful thing to have the latest and most advanced technology available. And the fact that it's available to anybody is a very wonderful thing.
From providing more beds to building state-of-the-art facilities, from purchasing leading-edge equipment to attracting top clinicians from around the country, Community Regional is still expanding.
As you walk through this building, there's a bunch of us that pinch ourselves every day that, wow, this is where we work, this is where we provide care. It's a wonderful facility.
As the only academic regional medical center, Community Regional is equal to none in the Valley and provides leading-edge services not available at other hospitals. Here are just a few highlights of some of those special services.
What we can do here is you see I'm bumping this.
First, Community's multi-million investment in specialty imaging equipment has given neurosurgeons better and more immediate information during surgical procedures. We are only one of 10 hospitals in the nation that has this type of equipment, says neurosurgeon Don Myers.
These give us a way to do what we need to do more effectively, quicker, with less risk to the patient. And so they're tools that help us take care of patients in a better way.
Hi, Angela. I'm Dr. Chow. How do you do?
Pretty good. How are you?
I'm just fine, thanks.
Community Regional is also the home to the Valley's only high-risk birthing unit, where specialists like Dr. Conrad Chow help high-risk moms.
Perinatologists are high-risk pregnancy specialists. They've had 2 or 3 years of additional training beyond their basic OBGYN residency training. And so they're highly qualified to take care of high-risk pregnancy situations.
Look at all these little feetsies here.
Hand in hand with the special perinatologist is a first-of-its-kind technology called STAN, the first heart monitor to ever give an accurate assessment of the level of oxygen in the fetus, says nurse educator Mary Burke. In fact, Community Regional is the first and only place in the U.S. it is being used.
This really shows us more definitely what's going on with the baby and how the baby's tolerating labor.
Another fascinating piece of equipment, the Valley's one and only CyberKnife. Oncologist Douglas Wong explains this miraculous technology.
CyberKnife, I think, is the most sophisticated system developed to perform non-invasive surgery. So instead of using a scalpel, it utilizes laser-like X-rays to precisely destroy tumors and other lesions. The neat thing about radiosurgery is that it is non-invasive. It's bloodless. It requires no hospitalization, no operating room, no anesthesia, no incisions, no scars, no pain.
Got this stable tachycardia.
Like CyberKnife, Dr. Catherine Bellello says the latest in technology and treatment attracts the finest specialists.
I think that we've been moving in the direction of a center of excellence, and I don't think anyone would argue that in order to be a center of excellence, you need specialists, and you need training programs that are creating specialists.
Since its opening, Trauma Director Lynn Binnick says the new facilities and the dedicated staff have attracted top specialists.
We've recruited, I think we have 4 or 5 neurosurgeons now. That is unheard of. There's a lot of trauma centers closing because they can't keep 1 or 2 neurosurgeons, let alone the ability to attract 4 or 5 of them.
His heart rate was 160.
Same with orthopedic surgeons. We've been able to recruit 2 or 3 orthopedic surgeons. We couldn't do that 2 years ago.
Community Regional CEO Jack Chubb agrees.
Probably the best way to summarize it is what an employee at one of the employee forums recently communicated was that over the last year, this has become the place to work in Central California, and healthcare.
We've had a challenging year. It's been a great year. I mean, if you look at the talent that is coming to this facility, the Community Regional Medical Center, the technology that we have available, and the Target 100 customer service culture that's developing, better keep your sunglasses close because the future looks pretty bright.
It sure does, Bruce. It's going to be exciting to see what these teams can accomplish in the year ahead. We'll keep you posted.